Well, the COVID-19 death rate is increasing again, and so is the infection rate. To get an understanding of what the latest figures mean, I'm joined now on Zoom by the head of the Public Health Surveillance and Response Division at the NICD, Michelle Groome. Michelle, thanks for your time. We appreciate it. You know, just the other day on Monday, we were looking quite optimistic in terms of the infection rate, but it's climbing up again over the past 2 days. And then so is the death rate. Do you have any idea what's happening?
Yeah, look, I think we do need to be cognizant, and, you know, often I always seem to dread Wednesdays because that's often the day that the numbers seem to shoot up a bit. And I think that's often just, you know, a factor related to how the cases are reported, and that people tend to test less over the weekends. And that's kind of reflecting the numbers that we've seen on a Monday and Tuesday. So if you look back over the weeks, I think Wednesdays tend to be when we see kind of quite a big increase from Monday and Tuesday's figures. That being said, I think we're nowhere, you know, near the end of the third wave. I think, you know, we definitely seem to have quite a lot of differences in the provinces during this wave. And so provinces such as Gauteng, you know, started a little bit later with their third wave. We had a very quick, you know, increase in cases, and those cases have come down very quickly. And we've kind of got a similar pattern in the other, you know, more northerly provinces, Limpopo and Northwest, whereas our coastal provinces, Eastern Cape, Western Cape and KZN are still seeing increases in cases again, and they're definitely still on their upward trajectory. And then we have the provinces, you know, Free State and Northern Cape were the first two provinces to start with the third wave, and they just haven't come down. You know, we haven't seen, you know, them coming off their third wave. So I think there's lots of different factors that may be driving this. And I think we really, you know, need to still be very vigilant in terms of sticking to the current, you know, adjusted level 3 restrictions, as well as, you know, the non-pharmaceutical interventions.
Yeah. So I see that 66,645 tests were conducted in the past 24 hours. Is that the right amount, the average amount of tests that we see being conducted in South Africa daily?
Yeah, so I think, you know, as I say, I think the day-to-day number of tests does vary. So often it's better to look, and that's why I think we often, you know, talk about the 7-day moving average with number of cases. And so in general, the tests over the last couple of weeks have been pretty stable if we look week on week. And actually, when we compare this week to the previous week, there was actually a very slight decrease in the number of tests. But I think that in itself may also, you know, there may be a lot of things even driving the number of tests. And all our metrics and the number of cases that we see is very much dependent on, you know, people accessing testing. And so if there's any reason that people, you know, aren't testing, that may also affect our numbers. But in general, you know, the number of tests do vary up from day to day. And I mean, that's why we try to average it out.
Yeah. If you can compare the previous wave to the wave we're currently in, what is that looking like? Is it worse off now or not?
Yeah, so I think it's been a very different wave, and there was very different circumstances, you know. So I think the second wave was towards the end of November, beginning of December. It was quite a sharp increase and sharp decrease, and most of the provinces had a very similar pattern. The schools and universities, you know, were on holiday. People were, you know, traveling for holidays, you know, whereas this wave has been more, you know, kind of during our business as usual. Children are at school, the varsities are open, you know, we're going to work. And so this wave has been very different. You know, we saw quite a sharp increase. We saw, as we did with the second wave, certain provinces starting earlier than others. There's almost like this relay of provinces. But I think what has been different is that, you know, we came off very sharply off the second wave. There was actually, if you look at the graphs, you know, it was a very sharp decrease, whereas this one has really, the rate of decrease has been much slower. And I think we kind of seen these, you know, week on week, you know, we haven't seen that dramatic decrease that we saw with the previous wave, which means really that, you know, overall this wave will have more infections. And I think this is largely driven by the variants. I think the Delta variant was something, we always said the third wave, we wouldn't be able to predict. One of the wild cards was the, a new variant emerging, and that definitely happened. And unfortunately, the variant, the Delta variant is very transmissible and much more transmissible, than even the Beta, which drove the second wave. And so I think that is really, it means that, when you're in contact with someone who's positive, there's a lot more people that will be infected from that one person.
And let's talk a bit more about a possible new variant. I know that the Delta variant is causing havoc in South Africa. Professor Karim obviously raising concerns about a new variant as well. Are you watching out for anything that we need to be concerned about in South Africa?
Yeah, so we are watching. I mean, at this stage, we have definitely, over the course of the pandemic, increased our, the sequencing of samples so that we look and monitor for the different variants. And there have been certain provinces where the sequencing hasn't been, we haven't had as much sequencing, provinces such as the Northern Cape or Northwest, but we're upscaling that so that we have a better idea. We are monitoring for any new kind of variants. And obviously, I guess with Delta, we were not blindsided, but I mean, I think, we saw what was happened in India, but they also hadn't had a lot of sequencing, and it wasn't clear until a lot later that was driven by the Delta variant. And with the second wave, the Beta was actually, first detected in South Africa. So it is definitely a worry, especially with the continued high rates of infection. The more transmission of the virus, the more likely, that the virus will mutate and cause a new variant. But we are monitoring. We put out weekly reports, and definitely, we are updating, the Department of Health. There's quite a wide network which is responsible for the sequencing. So we would be able to detect something like that, early on.
All right. Thank you so much for your time and the insight. Appreciate it. That was Head of the Public Health Surveillance and Response Division at the NICD, Michelle Groome.